Hello, we are 11B, and we will be presenting on Amazon Pharmacy RX Pass. In January earlier this year, Amazon Pharmacy initiated their prescription drug discount service called RX Pass, which is a subscription service where patients can get as many of their medications covered for a flat rate of $5 per month, so long as those medications are on their formulary. So the formulary consists of 50 generic medications. As we can see here, they do cover 50 of the 200 top drugs most commonly prescribed to patients, but it's worth noting that the list is very short and they're missing many commonly prescribed medications such as insulin and metformin, birth control, blood pressure medications like hydrochlorothiazide, beta blockers, inhalers, and analgesics.
So in terms of the public health interest, we noted a few pros and cons. For example, there's like a seemingly cost-saving aspect to the program. If a patient's medication list only consists of medications from this formulary, the assumption is that they'd be saving money with a flat rate of $5 per month. Additionally, this would be a mail order service, so this would hypothetically increase accessibility by eliminating the patient's need to travel to the pharmacy, wait in lines, etc. Additionally, accessibility is increased by the patient having to interact mostly through the Amazon app, which is free to download, available through all smart devices like phones, tablets, and can be accessed at any place, anytime. A few cons that we noted, in addition to subscribing to RX Pass itself, a subscription to Amazon Prime is also required. So in addition to that $5, you'd also be paying $14.99 a month. Another con we noted was that those who have difficulty using technology may find the service harder to navigate as it requires understanding how to use the Amazon app or website. Finally, but as we noted before, the medications list or the formulary is rather limited. So many patients would not actually be able to obtain all of their prescribed medications from RX Pass alone and will likely still be using their local community pharmacies to get the rest of their meds. Onto the pharmacist perspective. So a pharmacist that works for RX Pass would likely be using telehealth a lot to be communicating with their patients. Telehealth can be a bonus, but also serve as an obstacle when it comes to counseling patients. For example, if a patient has never taken a certain medication before and would benefit from a direct interaction with the pharmacist, this would be facilitated by a telehealth visit, but not all patients have the skills or the resources required to use technology required for a telehealth visit, and they may end up missing out on important components of patient care. Onto the pharmacist that doesn't work for RX Pass, like your typical community pharmacy. Pharmacists that aren't working for RX Pass will still likely be seeing patients who have medications uncovered by RX Pass. However, they don't have a full access to these patients' medication lists under RX Pass. And this may lead to missing key components of patient care, such as identifying polypharmacy or identifying drug-drug interactions. This is our reference list, and thank you so much for listening.